lips. We have finally figured out a time slot for Kate to have her lips done. And while she's been wanting to have it, we just didn't have the time to do it. Come closer so you can see the lips. So the most, the biggest reluctance people have for lip fillers is they think that everyone is going to end up with a trout pout or everyone is going to end up looking artificial. But that's not what a well-done lip filler looks like. In fact, a well-done lip filler will look like you have lipstick when you don't have any. And what we are trying to achieve are a few things in Kate's lips. So first of all, it's a balance of sorts. So when you've got a nose and a chin, which is fairly well established, you do need lips to come a bit forward and meet the line. If you come from the side, if I hold the pencil against the tip of the nose and the tip of the chin, you can see that the lip is not quite reaching it. So there's a little bit of capacity in terms of volume for the volume to come forward. Besides that, we can correct existing asymmetries, like in Kate's case, the show of the red on the right side is more than the left. You can see that the left is tapering off. So when we do lip fillers, it's about getting the lips to be less wrinkled, more hydrated, and to support the corners, because you can see that where the red in Kate's lip on the left hand side is less, she also has got a deeper downturn of the oral commissure or the corner of the mouth. And then if I were to stress this area by doing that, you can see that if she doesn't do anything, she will end up with a marionette. Not so much on the right side, because on the right side she has got more show of the red compared to the left on this side. So when we talk about lip fillers, it's not just about volumizing. We are addressing existing asymmetries. We are addressing loss of volume in the lips. You can see how dry and crinkled the lips are, so we're going to address that. We always do both the upper and the lower. And one of the things that most patients don't realize is as we age, they are pressing down on the lips. They're pressing the lips together, and you can see when she was stood there, you can see this area, the mental crease, getting deeper and deeper, deeper and deeper, because she's trying to compensate, relax, for the loss of volume. When she was younger, the lips touch each other without her having to do anything. As we lose volume with the aging process, we are having to push the muscle up to meet the lips and make them sit together. So often at times, especially when you're in your 40s and 50s, and Kate is only in her 20s. Thank you. Yeah, well done. So in your 40s and 50s, you'll see that you actually have the muscle leaving behind. Can you do it a bit stronger? Yep. Leaving behind this kind of a golf ball appearance because it's always active and you're losing the fat in the layer of the skin. So this pebble chin that you get as we are aging relates partly to the loss of lip volume. So lips are really important if you want to have a balance in your whole facial profile. We have a lot of options with the lips. We can use, my favorite is the Juvederm Ultra 3. I'm not affiliated to any of these companies. If a patient is seeking just hydration and not volumization, or is super apprehensive about lips, having it for the first time, this is great for hydration. Bellatero Balance. There is a Bellatero Intense, which has got a bit more oomph to it. So for a very delicate volumization and hydration, Bellatero Balance. Restylane Kiss, it's been designed for the lips. It is a great molecule, but my preferred molecule is Juvederm Ultra 3. It's a bit firmer, not that you would know when it's inside the lip, but Kate has gone for the Restylane Kiss. We'll catch up when she's had numbing with a very strong 23% lidocaine cream, about an hour. So she's pretty numb in the lips. We do not do lips without the very strong numbing, because it is one of those areas which can be a bit ouch. Not that I've had it, but that's what patients say. So pause it now. Okay, one of the things that you have to always consider and warn the patient of is when they smile, things change, right? So here's Kate without a smile, and now give us a smile. Can you see how she starts thinning out because she's pulling her lip in like that? Just one of the ways to smile. But we need to tell her that the dynamic of the muscles of smiling in her lips are different to others. So she does, when she smiles, thin out her lips much more than other patients do. Okay. So what I'm trying to do is find out where she starts tapering out. So she is okay till here, and then you can see that the peak of the right side is higher than the peak of the left side. So she starts deflating in a way, and then I am watching the vermilion or the red of the lip going right out to the corner. There's virtually none. So I need to first try to balance this side to that side. So that's what we'll do. Sorry. So we put zero point 0.1 mil, and you can already start seeing that there is more show of the outside. It clearly still is not as high as this side. So now we've gone this way. Now we're going to go vertically, and this is the so-called Russian technique. I don't think calling it a certain name makes it anything special. Lie down. You should be able to have any way of doing the filler to get you the results. I do not offer Russian lips. I think that's just a silly thing of trying to achieve a very unnatural look on the lips. We go for natural all times. Here we go. So now you can see that the right side is almost the same as the left side. So we've symmetrized the two sides. And this is the point at which we then start treating this as a symmetrical lip, and we'll now add the volume to the upper lip, the same on both sides. Okay, one of the things that patients are always afraid about is the filler migrating into this area. Now, that's a hard act to perform. If you do it well, you hardly ever get that. But the way you can reduce the chances are by injecting the filler at a junction of the wet. So that's the wet lip, and that's the dry lip. So if we carry on in just underneath the skin of the lips, like so, you get a very nice subtle volumization of the lip without there being any risk of migration. So I'm happy with the volume that we have got there and there. It looks nice, especially once we've done the lower lips, it'll look more balanced. I will now try to heighten the central cupid's bow by doing a few things, and you'll see the changes. So keep focusing on this area, and then we'll come back and show you what we've done. Pause it. Breathe out now. Very good. And then turn your head a bit. Breathe in. Breathe out now. Chin up. Breathe in. And breathe out now. Sit up for a second. So we finished with the upper lip. All we have done is we have made the two sides symmetrical. We have supported the corners. No, don't smile. Come on. Yeah. So when she's not smiling, you can see that this corner seems a bit more supported because I've done a bit more there. But it's no longer pointing down. It's already slowed down the folding when I stress it. We will be doing a little bit more when we do the lower lip. But I'm very happy with the upper lip. It's looking natural, looking soft. And basically, one of the things that happens the moment you have lips is it softens your features. It just takes away the harshness of a thin lip and softens the whole face up. So now we're going to do the lower lip, and then we'll come back. Okay, so you can see that she has got this nice bow shape to it. So this is the most prominent, and there is a little concavity on either sides of this high prominence of the central tubercle. Now, in nature, that is designed to fit a little bulge of the lower lip. So we're going to design the lower lip bulges, and here we go. Sharp scratch coming your way. Scratch. Sorry. So one of the things Sally was pointing out is that the swelling of the lips immediately after contributes a bit to the result. And while that is true, right now what she's saying is pretty much what she will have. The one thing you have to be careful with is that just like if you made a dot on a balloon when it was deflated, and if you were to blow up the balloon, the dot would become bigger, right? So one of the things one has to be very careful about when you're volumizing is that you will highlight existing asymmetries, existing imperfections, and you always need to think about what's happening as it happens. And while we have got a symmetry, we have got a lovely soft look. We've only used zero point 0.6, so probably around zero point 0.3 per side, and we got zero point 0.4 left. So what we can do is improve the frame of the lip by reducing this so that the face appears more balanced, because one of the things that happens with our face is that the forehead starts becoming the tallest part of our forehead of our face, because the hairline naturally recedes. Now Kate is blessed with this forehead, and this is a bit exaggerated because of the way she's wearing her hair right now, but you can see that if you consider the vertical height of the forehead and the height of the area from the nose to the chin, this the lower third is shorter, right? And she's holding it up. So we're going to do this mental crease, and you may or may not be able to see how it helps with the balance. I'll also be using the leftover filler to balance the corners. Okay, and breathe out. There we go. So one of the things I always do at the when I'm satisfied with this thing is I will make sure that the filler is lying smoothly in the area and there are no kind of individual bumps left behind. Having said that, in the recovery phase, a patient may or may not feel a bit bumpy in one area over the other. But if I am happy with how it feels right now, in almost all cases, that lumpiness goes with time and does not affect the visible result. So this by far is the most important thing. We spend our time, we'll be holding the pressure in this place for a minute, making sure that all the bleeding is stopped, because that contributes to less swelling afterwards and also reduces the chance of bruising. And if you are going to bruise, it reduces the intensity of the bruising. So we do spend some time holding the pressure for a minute. We'll catch up in a minute. So we finish with the lips, and you can see that this is going to be more or less how her lips look. Will they deflate a bit? Maybe they will go down a bit in the swelling, but largely this is. So we have achieved symmetry. Both sides are looking same. We achieved a very nice Cupid's bow. We have achieved a nice little enhancement of the pillows on the lower lip. We have reduced the crease under the lips. So now we've got about 0.2 left, and my plan is to do it in the central area of the chin to make her look less square. I want her to have a little downward projection of her chin to balance her face. You might already know that there are two ways of delivering dermal fillers underneath the skin into the subcutaneous tissues. One is what you saw just now, which was using a needle and using retrograde threading. So the filler is deposited as we are drawing ourselves out. Sometimes it is done as a bolus where we stay there and just deliver a droplet of filler. The other way of delivering filler is doing a cannula technique, where the cannula is essentially a blunt tube, and I wouldn't be doing that if this was a needle. So it has got no sharpness to the tip of it, which makes it less traumatic. We need to make a hole with a needle first so that it can go in. and then the filler comes out sideways. If you come a bit closer, and if this works for us, you will see it's probably blocked now. No. So the filler comes out from a hole on the side of the tube. So it doesn't directly come out from the tip. I never use the cannula in the lips. I use it elsewhere in the face. I use it a lot, but never in the lips, because nothing is as precise as a needle in the placement of dermal fillers. It's much more precise compared to the cannula. Marked out her middle. Now all of us are asymmetrical, and so is she. She has, if you were super observant, you would see that she has got a bigger volume here compared to here. She's got a divot about there, so that's where I'm going to go. And this one, she's going to be a bit sat up, but it's going to go down. And I'm just going to engage the needle against the, no, you stay like so. I'm just going to feel where the bone is, and I'm going to engage the needle against the bone right in the middle. I'm going to feel the bone. I'm sat on the bone. Now I'm at the tip of the thing, and then I will disperse my filler. I'm going to give a very large bolus of about 0.1 or 0.15 in this spot. This is a very low pressure injection. It's directly on the bone. Sit up. 0.1 in there, and you can see that there is an improvement in the height, and you can see that it seems like she needs a bit more there, so that's where we will put it. Sorry about this. Once again, it feels the bone, which is there. I'm on the bone, and I'm going to just drop a little bit more there, not as much as the other side. So we finished with the procedure. You can see that there is a bit of a curve to her chin, which used to be rather flat. So it's given, it's kind of, all of these things work together. There is no one way of doing it. So we've symmetrized the upper lip. We volumized the upper lip, so she doesn't have as many crinkles as she used to. We have volumized the lower lips. We have made a nicer cupid's bow. We have strengthened the filtral columns. We have added the lower lip pillows. We've reduced the mental crease. We've supported the oral commissures. We've reduced the downturn that she used to have. And then we have contoured her chin with 0.3 mils of dermal filler. I've also given a little bit with that same 0.3. We've also done a little bit here where she had a pre-jowl sulcus or a pre-jowl groove there. So it's kind of flowing in. So one of the ways to preserve this result is to inactivate the muscles that are going to pull the lip down. So do this for me. Turn it out. So when she does that, she's marking out the depressor angular oris, which we want to inactivate, and then the mentalis in 3 places. So we're going to give her anti-wrinkle injections for these places to help with preserving the result of the fillers. Okay, lie down. So this injection is going for the depressor angular oris. That's 2 units of Bocature. It's another 2 units for the other side. And now we're left with 6 units, which we are going to do the mentalis with. So that is a comprehensive treatment for lips, because it's not just about the lips, it's about the frame around the lips. So you have to treat all of those components to get good results. If you're affected by this and want more information, do get in touch with us. Bye for now.